Hello there, is it Mrs Jones?
It is, yes.
Hello, my name's Geordie Morell. I'm one of the doctors on the ward today. I've come to talk with you about some results of tests you've had recently.
Yeah.
Can I just check I've got the... I just need to make sure I'm talking to the right person. It is Mrs Jones, isn't it?
Yeah, I'm Jones.
That's lovely. So, can you just tell me a little bit about what's been happening recently?
Well, I've had this cough for ages and I seem to have lost some weight as well. And
Okay.
eventually I was bullied into going to the doctors.
Right, sorry. And have you any idea what might be happening?
Well, I'm worried it's cancer and it's the smoke, you know.
Okay. And why would you think it was cancer?
Well, I don't smoke much, just perhaps one or two a day, but, you know, until recently there's been smoke everywhere and you can catch it. And the two things I thought...
Right, okay. And have you had any symptoms like this before?
No.
Okay. Well, the first of all, we have a chest X-ray. Now that shows some unusual shadowing on it, but it doesn't look the sort of shadowing that I'd expect from cancer. It looks more like the sort of shadowing I'd expect from a type of infection. And then, if you remember, you gave us
Just hung on for so long.
I know. What was it that put you off coming to see us?
Well, lots of people have coughs that hang on for weeks and, you know, nothing, if they do go to the doctors, not a lot happens. And I just thought it was one of those, but it has been going on now a couple of months or so.
Right. And that must have been quite worrying.
Yeah, when I decided it was probably cancer.
Right. And do you know anyone who's had cancer or who had similar problems?
A neighbour had lung cancer, yeah.
Okay. And what happened with them?
Well, they died eventually.
Right, okay. I'm sorry about that. And how old were they when they...
Oh, 50s.
Right. And correct me if I'm wrong, but you're in your mid-30s at the moment?
Yeah.
So you're quite a bit younger?
Well, yes, but even so...
Okay. Well, as I said,
what else it could be.
Right. Well, there are lots of other things which cause cough that aren't cancer. So I don't think it's cancer. Okay.
Right.
I think there's much more common things that can happen to someone in their mid-30s that are not cancer.
Right.
Okay. So what we have.
So it's basically good news then.
Well, it's good news in that I've got no evidence that it's cancer. But the sputum sample that you gave us has grown a bug, and that bug would suggest that you have something called tuberculosis. Have you heard of tuberculosis before? Right. What do you know about it?
Well, yes, a cough. I suppose I don't know too much. I don't believe this. You know, I was scared it was cancer and it's good news it wasn't. But I'm not sure this is much better. In fact, I don't believe I have got tuberculosis. You've got the wrong notes. You've got somebody else's notes.
Why would you think that it was...
Well, I can't see where I'd have got it from. I mean, you catch it, don't you? And
on the whole, yes.
You know, I'm at home, I don't work, and I just don't see where I've got it.
Right. Well, we can certainly try and explore how you might have come in contact with someone with tuberculosis, but our test was quite is quite a sensitive one, and the other symptoms we found. So we noticed the changes on the chest X-ray, and I think of the symptoms you've been having with losing a bit of weight and the cough. These are all things which would fit quite well with tuberculosis. Obviously, we we don't make diagnoses lightly, and we check and double check. So we'd be sending off another sputum sample, and because I appreciate that people are concerned about serious diagnoses and the possibility that that there's been an error somewhere. So we do like to make sure that we've got the right person and the right diagnosis. But at the moment, it does appear that you do have tuberculosis based on the sample that we've got, and you said that you don't feel it's a better diagnosis than cancer.
Well, I mean, I'm not sure really, but some people seem to have it for years, and
I mean, it's
at least I can't give the family, if it was cancer, I might pass it to them.
Well, you're right. It is an infectious disease, but it is an infection, and as with the vast majority of infections, it's eminently treatable with antibiotics. So we've got a variety of good drugs that we've been using for many years, and I grant you it's not an easy infection to treat, but it is treatable. And the sooner we start you on the treatment, the sooner we can get you better.
All right, well, I'll give you the tablets. I'm going home. I want to go home. I mean, I suppose this is why I'm now in this side room and
That's
feeling like a leper.
right. Well, I'm sorry you're feeling that way. It is, but you understand that the reason is to try and minimise the spread of infection, and that's why we need to keep you out of touch with other people who you might give the infection to. You said yourself you were worried about, that you couldn't pass cancer on to your family, but you could pass this infection on. Do you agree?
Yes, but I'll stay indoors and I'll wear a face mask, which is what they do here, and be just careful about washing and things.
Do you mind if I ask why you need to go home?
Because I feel uncomfortable here, shut away, and I just need to be back with my son, because whilst my mother's looking after him, she's not in amazingly good health, and I don't think she could do it for a long time. I mean,
right.
The odd day here and there sort of thing, and she's already had James longer than I would like.
Right. The issue with going home is that, as you've said yourself, tuberculosis is something you can spread to other people, and in spite of making very good precautions in your own home, it's still quite possible that it will be passed on to other people. Those face masks, they're not a bad precaution for people coming into the room, and when you need to move out of the room while you're here. It can sort of limit the risk, but when those masks have been on for a few minutes, then they will start to leak the air, which will contain the bugs, and I'd be very worried that you might spread it to your son or anyone else. Is anyone else at home?
Well, my husband.
Your husband as well.
But he's a lorry driver, so
he's out.
He's out a lot and away at nights sometimes. So he's not really around to look after my son.
Right.
Which is my main worry.
But your son's being looked after at the moment.
Well, he is. Yes. Yeah.
And is there anyone else around who can help? Because it sounds like you're worried about your mum struggling.
Yeah, I mean, I've made some arrangements, like a neighbour takes him to school and brings him back. But the problem is, the school holidays are starting, aren't they? Because it's almost Christmas, and she wouldn't cope with that, having him all day.
Well, there is help available, and I'm quite happy to do everything I can to make sure that he's being well looked after. But you're my patient, you're my main concern. I'm obviously concerned that this is an infectious illness that could spread to other people. So I have a duty as well to make sure that we confine it as best we can, and we don't spread it to family members or other people in the community. Because with the best will in the world, when people are at home looking after how old is your son?
He's 8, just 8.
So looking after a young lad.
Yeah.
There is a high chance that it'll spread to not only him but other people, and having spread to him could make him very poorly, obviously, and that's something neither of us want. But then he could pass it on to other people, and we could have quite a serious public health problem. The better option would be, let us help make things right at home, make sure that he's being looked after while you get better.
What happens if I don't take that advice and I go home?
2 minutes remaining.
Thank you. There are issues surrounding this sort of illness because it can affect the wider public. There are actually laws that prevent people with this sort of infection from being in the community. So I don't want to have to use those laws.
So you say you can keep me in anyway?
We can.
How long do you think it'll be?
It depends on how quickly you respond to the antibiotics. I would be expecting it's going to be at least a month, but we would see how things go.
Oh, that covers Christmas.
I know.
And the Christmas holidays.
But if you think about it this way, this is one Christmas, and getting your health sorted now will mean that we've got many more Christmases ahead. Yeah? Of you and your son, your husband.
Well, you're not going to keep me here on a compulsory note as if I'm a mental patient being
I wouldn't want to do that.
sectioned. I'll have to agree, won't I?
Good.
But
I appreciate it's difficult, and I understand, but the most important thing to me is getting your health sorted, and the sooner we get the treatment started and we get the infection under control, the sooner we can get you home. And I don't want you to stay in hospital any longer than is strictly necessary. Is that okay?
yeah.
Now time's a bit short, I'm afraid. Is there anything you want to ask me?
This treatment you're going to give me, is it sort of tablet form?
It is tablets, yes.
Yeah.
Initially it's going to be several, but then when we find more information about the exact type of bug and what it's going to respond to, we reduce those tablets. All tablets have side effects, and I apologise for that, but nothing's perfect, I'm afraid.
So I just
Excellent. Can I stop it there just on the interest of time?
Sure.
Dr. Morrell, would you like to just give me an overview of the priorities in this case and how you dealt with them?
Okay. So this is a 35 years young lady who's currently an inpatient, has concerns that her symptoms are consistent with cancer, with weight loss, a persistent cough that's been troubling her for several months, with some weight loss. The information I have is that her chest X-ray and a sputum sample are consistent with a infection with tuberculosis. So my main concern was to ensure that she was isolated and started on treatment as soon as possible. And that was what the bulk of the time I had was spent with. following on from that, I'd need to move on to other issues. So we didn't really have a chance to talk about how she's contracted the illness, talking about contact tracing, etc. She said she didn't know how she'd come in contact with it, so there wasn't an obvious source, but obviously we talked perhaps a bit about there's sensitive issues that people she might have been in contact with. Possibly her husband's a lorry driver, away a lot. He may have been driving through endemic areas and caught it on the road. So there's other issues there. The other piece of information, which unfortunately we didn't have time to get around to, is commonly tuberculosis can come hand in hand with HIV, and it seems that she's had a HIV test which has come back positive.
Yes. Yeah.
So in this scenario, I felt that the HIV was of secondary importance to the TB, but it was obviously something I'd want to come on to with a bit more time, and that would have been a very delicate issue, and something we'd had to have spent a great deal more time discussing.
So you felt there wasn't enough time really to discuss that?
No, I think
agree.
we achieved the primary aim was make sure that she knows the importance of staying in hospital and being concordant with her treatment.
Okay, good. And do you think this obviously this information is quite a lot for her to take in and was difficult for her to assimilate?
Yes.
Do you think it would have been nice for someone to be present during that consultation?
Ideally, yes.
Yeah. Okay. And how would you how would you bring that into how would you introduce that sort of concept of sort of what kind of things would you?
I think
at the start.
At the start, I probably would have had a time again. I would have asked if there was anyone she'd like to be present. I think that if there wasn't anyone on the ward at that time, then it would have. I think it was important that she had the information as soon as possible.
Yes.
So I think perhaps waiting for if this is early morning, waiting for visiting time in the early afternoon, probably wouldn't have been practical.
Yeah.
Especially if there was a risk that she'd be wanting to go home, and if for some reason I'd missed the opportunity to tell her what was going on, and she'd managed to leave the ward and
if she was a patient who was in an open bay, what implications would that have? What clearly you mentioned this is an important thing that the information has only just come.
Yes.
So how would that influence what you would do as well, and the speed at which you would do it?
I think we'd need to move her we need to isolate her as soon as possible, really.
Excellent.
And I would probably be looking to screen the rest of the ward and make sure that people and nurses caring for her especially make sure that all healthcare workers ideally should be vaccinated, so they should have BCG, but obviously it's not universal.
And certainly, which part of within the hospital, which department would be involved with that sort of contact tracing, if you like, within the hospital?
Probably the occupational health department.
Yeah, I think so. Yeah, good. Excellent. Thank you very much.
Thank you.
Okay, so that was excellent, Dr. Morrell. I think you basically handled the points in a constructive manner, and you answered her concerns. And you got the background knowledge of what she knew about those conditions before you were going to go on to tell her. Clearly she was off-piste when she was talking about cancer, and you didn't just jump over that and go on to the issues of TB and HIV, and they're huge issues, and I think you demonstrated the fact that if you have such big issues, you just can't rush them. And although the scenario suggested TB and HIV, you never got to HIV, that's absolutely fine, because it depends how people react, and she clearly reacted in a sort of very negative way, certainly with cancer initially, then TB, so you didn't have time to go to the HIV issue, and I think that was, you did things in a very slow and controlled manner, dealt with what she knew, and then put her misconceptions to bed, and then moved on, so I think that was excellent. One or two things we mentioned, I think, during our interaction, did she want somebody there? Which is always ideal if you're delivering information. However, the speed of the information that you needed to tell her, she needed to go into a side room if she was an open ward, so that may negate the fact that she could have somebody with her. So we talked about that. She's already an inpatient, so you think you dealt very nicely and brought in the other implications of why she should remain an inpatient and why she shouldn't go home. So I think that was dealt with extremely well. I think all in all, there were lots of positives. The only downside is you didn't deal with the HIV, but I think that's fine. I think you demonstrated quite well that you can't deal with everything that's in a scenario. It depends on how the patient reacts. And certainly one of the biggest things that I come across when candidates are doing the communication is that they ignore cues for the patient. So the patient will bring up a cue, that will be ignored, and they'll move on. And you beautifully demonstrated that you dealt with those cues from the patients and the patient's concerns. So I think that was excellent. Well done.
Thank you.